the paperboy, evening TV. How did I get to live in here? Somebody tell me please. This old world's confusing me. Clouds is mean.
All right, Miss Garcia, we're gonna add digoxin to your treatment and the team will check back on you in the morning.
Thanks.
Dr. Ebright, I noticed that the patient was on maintenance for Apamil and you just added digoxin. I was wondering if you meant to do that because those two could have really dangerous interactions.
I don't care if you have a doctor in front of your name. You're just a druggist and you are not in charge of this patient's care. I am, and if I think the patient needs those meds, then she gets those meds.
Let's try that again.
Dr. Ebright, I noticed that the patient was on maintenance for Apamil and that you just added digoxin to their treatment. I was wondering if you meant to do that because those two could have really dangerous interactions.
Thanks for pointing that out. I didn't even catch that, which is weird because I'm very intelligent, but is there an alternate medication you recommend?
Ta-da!
Let's point out some of the key issues of the first encounter. Patient care and safety is a concern, and there's a risk for medical error or harm. There's also a hostile work environment and power imbalances at play. In the first scenario, the attending communicated in a way that is demeaning and humiliating. By responding in the way that Dr. Ebright did, she's refusing to collaborate and treating her colleagues as less valuable. In the second encounter, the PharmD resident, Dr. Wright, demonstrates that if you know or feel as though something is not right, find an appropriate time to have an open and respectful conversation with the attending. In some cases, it may be necessary to report the attending's behavior to proper individuals, especially if this is an ongoing issue. If you feel comfortable enough as a bystander to speak up, do it. You can also anonymously report the situation. Encourage collaboration by remembering that every team member is important and knowledgeable. Be open to giving and receiving constructive criticism. Bottom line, patient safety comes first. It is important to do your part to maintain a collaborative and constructive environment, especially in educational settings. Your words and actions impact more than just yourself.
Everywhere you